Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This is our favorite time, of course, when we have these great doctors. And I found a really good one. He's an internist. You don't even hear those words anymore. Yes, he's an internist, and he's attractive, and he's friendly, and that's what I like about it. So his name is Dr. Edward WINOKUR, WINOKUR. He is affiliated with Broward Health North. Of course, you know that's one of my favorite hospitals and the people who work there. But what I want to do this morning is just get a little conversation going with Dr. WINOKUR and see why did he become this great internist. Welcome to our show, Dr. WINOKUR.
Good morning, ANITA. Thank you for having me. I think that primary care and internal medicine is really important because that's how you reach out to all ages of the community.
Okay, all ages of the community, huh? Well, let me just tell you that when you say all ages of the community, when I asked Dr. WINOKUR, I always like to know about his doctor's patients, and I said, do you have anybody over 100? And what did you say?
Oldest patient is a 106-year-old, a ranked bridge player, smart as a tack, and has the best quality of life you could ever expect.
And what do you attribute that to, Dr.
The
WINOKUR?
3 exercises that are mandatory: social exercising, getting out there and being with other people; physical exercise to maintain your immune system and health; and mental exercise. And I think playing bridge or any of the mental exercises keeps the mind sharp and has been shown to decrease the risk of dementia like Alzheimer's disease.
Well, that's pretty good. Those 3, huh? We ought to really do an article about that. That sounds really important. And people hear those things, but it's the motivation. And you as a physician, I can tell just by your demeanor that you motivate your patients. I can see it with this nice smile and the kindness that come out of your eyes.
Oh, thank you.
Makes a difference. So you understand about physicians that the medicine is you're caring about your patients, putting your arm around them, and showing love.
Medicine is a relationship, and not just patient to doctor, but community to doctor as well. That's why being blessed in the Lighthouse Point area where I am and being affiliated with a very strong hospital, Broward Health North, really gives me the capacity to offer everything that the community needs, my patients need.
Yeah, that's beautiful. Well, I'm glad they found you. So before I know we have to do some very important discussion on the flu, because I was amazed. I always get my flu shot like in October, and I think, well, by December, January, it's over, and you're going to tell me something different. But before we go there, let's just talk a little bit about you and your specialty. So you're an internist, and you also, I see where pulmonary is important to you too. Do you have to have a special thing when you're an internist?
Correct. So after finishing college, go to medical school for 4 years, and if that's not enough, then you have to go do your residency. I did my residency in internal medicine, which is a 3-year program, and I did that in Michigan. After which I then moved to the University of Massachusetts, where I did ongoing studies to become a specialist in pulmonary medicine and critical care medicine. After that, I moved to Connecticut and opened a beautiful practice for 27 years in a small town, very much like Lighthouse Point, Clinton, Connecticut, for those people who know Clinton and know Connecticut area. I was there for 27 years. And then one fateful day I came down to Florida and realized I didn't need a snow shovel. I went to a conference in Fort Lauderdale, and during that time I looked at my wife and she looked at me and she goes, wow, these are palm trees. How cool. And after a couple of phone calls to Broward Health North, and she made a day trip around the area, we decided that this is the place we wanted to be, and within 2 days we were signed, sealed, and delivered. And I've had the luxury and the honor of practicing in Lighthouse Point, right off of Sample down the road from Broward Health North Hospital, for the last 2.5 years.
Yeah, well, we're going to give also a phone number. So yes, Dr. WINOKUR is associated with the Broward Health North Hospital, but he does have a private practice, and I'm going to just happen to give you that phone number if you want to call and make an appointment. And I think you'll want to do that after you hear this special physician. 954-933-9600. This is Pencil Talk Radio. Remember, get your pencils out. 954-933-9600. So let's just jump very quickly then into the flu, because you're going to tell me things that I did not know as well as our listeners.
I think that you have to have an understanding about what flu is. Influenza is completely different when people say, oh, I've got a stomach flu. Influenza is a viral infection which is frequently seasonal, usually starts around October, and we always hope that it ends by about February, but as we're finding out this year, that is not always the case. A virus is different than a bacterial infection. If you compare a virus to a bacteria is about the size of a basketball, a virus is about the size of a grain of sand. A bacteria floats around in your blood and can cause infections to any organ system and is usually treated with antibiotics, and then the white blood cells eat up the bacteria and it's treated that way. Viruses are a completely different animal. A virus is so small that it can actually get into the cell and changes your DNA and RNA so that those cells affected become pathologic. In the case of influenza, the flu bug is transmitted through respiratory droplets. Now, what we mean by a respiratory droplet is the mucus that is propelled with a cough or a sneeze. When the patient inhales these viral particles associated with the mucus excretion, about 1 to 2 days later, they start with the infection and all the symptoms associated with it. It does not transfer touching someone or hand to hands or shaking hands. It's really direct droplet inspiration of the affected particles. Now, it's interesting. When someone sneezes, you say, oh, that's really loud. But the reason a sneeze is so loud is the actually velocity of the sneeze. You're breaking the sound barrier. We're talking sneeze velocity of 400 miles per hour plus, so that if you are 6 feet away, 7 feet away, guess what? You are now exposed. And that's why the most important thing is, if you're going to sneeze, you do it into your elbow. If you're going to cough, you do it into your elbow. Avoid the propelling of the virus. And that's the most important thing. Second thing, wash your hands so that you don't keep contaminating yourself as well. You know, the hygiene is one of the most important things.
Let me just tell you that people who fly on airlines they're fine when they go, and they wind up sick when they're off the plane. And is that because they're just too close to all this disease?
That's exactly it. As a matter of fact, a lot of epidemiological studies have shown that some of the worst cases of tuberculosis have come out of airplanes. Airplanes have to be hermetically sealed in the cabin, so it's not like you're getting fresh air. So if you're going on a long flight and somebody 6, 7, 8 feet behind you has got the flu and they're coughing, and these droplets are propelled at such a velocity, you can guarantee that you are going to inhale some of those, and within 1 to 2 days, your vacation might be a little bit compromised.
Absolutely. And so we can't wear these, I guess you could wear little face masks when you're in the airplane. You look a little stupid, but maybe that's the thing you should do.
No,
Would that help?
Absolutely, you're seeing a lot more and more of that. And then also we recommend that people who are on airplanes and the air quality is very, very dry, make sure you drink plenty of water. But if you are sick, if you know you're sick, yes, I agree with you. I think that's a very smart comment. Wear a protective mask so you don't become a public health risk to other people on the plane or train, or if you're in close proximity with co-workers. I think that's very important to help protect from spreading this epidemic. Let's call it what it is. It's an epidemic.
So let's talk about the actual shot. So it surprised me that you say, here it is, it's March, and you think people should still take the flu shot? And tell us why.
Viruses can mutate. That's why there is no cure for the common cold. Because what might be considered a cold one day will change the next day and can change a week or 2 weeks later. And that's why it's not unusual for somebody to catch a cold one week and say, oh, I got all better, I got sick again. It's not that you're having a recurrence of the previous one. It's that these viruses can actually change. Now, earlier this year, they identified the flu as the H1N1. And that was what was very common in October, November, and into December. There seemed to be a little bit of a decrease in flu activity until a couple of weeks ago when all of a sudden people started presenting with acute flu again, and they're now finding that it is a different flu. It's an H2N3 flu. And they said over the last 2 weeks or so, there has been a resurgence of this second wave of flu, especially in the southeast. See, I'm not the only one coming down to Florida. The influenza H2N2 is coming down as well.
Oh, boy.
So we're having a second flare-up, and people say, well, uh-oh, I got my flu shot really, really early, or I never got my flu shot. Is it too late? And the answer is no. You can get your flu shot anytime, and we should definitely be doing it now because it takes about 2 weeks or so for the influenza vaccine to really activate and stimulate your resistance. And with the resurgence of the H2N3 flu, it's not too late. Please talk to your doctor. And if you haven't had the flu shot, get it now.
So if they come to you, sometimes we worry that the flu shot isn't even available. So if they come to you, you have the flu shot?
This year, the flu shots are widely available. Most insurance programs will pay for it. You can either get it at any pharmacy or the doctor's office.
You know, I have to stop you there. I don't get them at the pharmacy. I have to go to a doctor. It's interesting. I just don't think that's appropriate. And that's maybe my own feeling, but I'd rather come to you, to your office, where you do it, and you have a record of it. Am I wrong? I don't.
You're never wrong. You're in charge of the program,
Okay.
so you are always right. But what I would say is the more easier access and availability to the community, the better it is. And it's really the same flu shot, whether you get it from the doctor's office or the pharmacy or any of the urgent care centers. Now, interesting.
Well, let me just tell
Sure.
people if you've just tuned in. You're listening to Dr. Edward I. WINOKUR, WINOKUR. He is an MD, and he is affiliated with the Broward Health North, and he also has his own practice, and you can call him at 954-933-9600. Okay, please.
So people say, does the flu shot work? And I think the important thing to understand is where they even come up with the flu shot. Because every year you say, well, gee, this isn't the flu shot from last year. And where are they coming up with all of these Southeast Asian named Bangkok flu and Hanoi flu and Brisbane flu? Said, I'm not going anywhere near Australia or New Zealand. But interesting enough, the influenza that we have this year, the CDC looked at the whole Pacific Southeast Asia rim because influenza follows the jet stream. So it starts in the Eastern Pacific, follows the jet stream across the Pacific into the United States. So they look at these countries and they see, well, what flu is occurring here? And they pick out the 4 most common flus. You'll hear names like Brisbane and the likes, or H1N1 or H3N2. These are the varieties of influenza that they think might come into the United States the following year. So that basically gives them all of the spring and summer to make the flu shot from what they think was occurring in the Pacific that they will now be treating in the United States. If they were right, they were brilliant. If they were wrong, it is still effective because stimulating your white blood cells to recognize a viral flu particle will still help you with a resistance So even though they might not be 100% spot on, it is still going to be effective in that your immune system will be stronger and you'll have more to fight the influenza should you get it.
You are so brilliant on the flu. I'm sitting here mesmerized by you with what you're saying. So I have two questions. The first one, so if we got an early flu shot, it's still going to take us through, even though they're a change in what maybe the flu strain is?
Absolutely.
So you don't want to take a second one?
Most of the time, a flu shot will last 4 to 6 months. So if you get it in September, 2 weeks for it to really build up in your system to take effect. October is really when the flu season starts, and then we always hope that by February, March, when things starts to warm up, it goes away, except for this year.
That's right.
So this year, they're actually having this H2N2, which seems to be hitting the southeastern states. They've seen the most number of cases in Alabama, Louisiana, Arkansas, Mississippi, Georgia, Kentucky, North Carolina, Virginia, and West Virginia. There have been not many cases here in South Florida, but as we talked about earlier, with the easy transit from one place to another, and the trains and the planes and the cars, it's going to be inevitable. The H2N2 is a variant of influenza A and is still sensitive to the flu shot that you might have received in September or October.
Okay, now I need some help from you. I wish I could take what you just said, put it on my arm, hit the button, and all my friends would say, I don't take flu shots. And I try to tell them, yes, you should take a flu shot. No, I don't believe in flu shots. Push the button and have them listen to you. What is it with people?
That is one of the biggest problems that I hear in the office. People say, oh, I'm allergic to eggs, I can't have the flu shot. And back in the day, and we're talking decades ago, they used to take the flu, put it in an egg to incubate it, and then take the antibodies out of it. And they had some egg reaction, but we don't do that anymore. Now that we're into the being able to develop these influenza vaccines in the laboratory, eggs really do not constitute a contraindication for getting the shot. Second thing, people always say, oh, I get the flu shot, I always get sick. And you don't get that. We are not giving you the virus with the shot. Back in the day, again, decades ago, during the days of the swine flu epidemic, and I believe it was in the 60s, we were actually giving an attenuated virus, and we would give you a little bit of a virus, and then your body would develop natural immunity because you had it. Again, we're not doing that anymore. This is not active vaccine by any means. These are all passive vaccines. So if you're going to get sick, you would have gotten sick anyhow. Yes, you can have some localized reactions with any shot. Not only are you getting the actual vaccine, there's preservatives in it that could give you a little local irritation in the arm. And anytime you get a shot, they go, oh, look at my arm, I got a little owie. Yes, you can get owies from a shot, but that could be of any shot, and it's nothing specific to influenza.
This is so brilliant. I'm just mesmerized. I don't want to repeat myself, but I am so thrilled that you're here doing this with us this morning. So when they say it's especially important for children and for the elders, tell me why that's true.
So we found that people who develop the influenza will normally get rid of it within a week to 10 days. Yes, you feel lousy, you have the typical symptoms of the severe fevers, and I'm talking about fevers that could go up to 103, 104. People ask me, well, what does flu actually feel like? If you have ever been trampled by a stampede of elephants, and if you've ever sat on the face of the sun, this is really what the flu feels like. You feel like, and I apologize for getting technical, you actually feel like caca. You have fevers, you have severe body aches, cough, headaches, absolute fatigue. You can't even get out of bed. It is severe. So when people say, well, what can I do to prevent it? Again, the flu shot. People say, but I've never had the flu. Fine, you've never been stampeded by elephants and you've never sat on the sun, but it doesn't mean it can't happen. So get your flu shot, not only to protect yourself, but heaven forbid you get the flu, it will protect people around you from this epidemic.
And you get the flu shot, don't you?
Oh,
and your wife gets the flu shot.
Absolutely.
Right.
Anybody and everybody that I know gets the flu shot. The CD estimated that the flu shot can reduce the risk of influenza by 47% in vaccinated people. And there's really no reason not to get the flu shot. As you mentioned, the people at greatest risk for developing complications from the flu are the elderly. And again, I find this insulting, but it's now people over 65. And since I'm 66, I just sort of take, but anybody 65 or older will have complications. It might have complications.
And what are complications?
And the very, very young, people under 5, or people with compromised immune systems, if you have problems such as heart failure, diabetes, if you're prone to infection, or anything that will compromise your immune system, such as any cancers or debilitating diseases, put you at the higher risk for the influenza A and influenza B.
So it's not a pretty picture, is what you're saying. It's pretty serious.
No, I don't want to get stampled by a herd of elephants, that's for sure. Say, if I'm pregnant, should I get it? And women who are pregnant or up to 2 weeks after having a baby should get the flu shot. People of Native American and Alaskan natives are also found to be at a very, very high risk. I'm not sure. And people with underlying diseases such as asthma, any neurologic disease of the brain, chronic lung disease, which is all of our smokers out there. If you smoked for a while, you got chronic lung disease. People with heart disease, blood disease such as sickle cell disease, disorders of the kidneys, liver, or any metabolic problems. If you have a weak immune system, patients with AIDS, or you're on chronic medications such as steroids for a multitude of reasons, you should get the flu shot. People with extreme obesity, they're saying are now at a high risk. And I found that fascinating that the CDC is now putting them into the same group as everybody else. But this year, and I found this fascinating, since October 1st, how many cases of flu have been reported?
I have no idea.
26.3 million cases in the United States. And this is what is reported. This is not the person who went home and had it. This is what is reported to the CDC. 26.3 million cases of the flu. 12.4 million of them required a visit to an emergency room hospital or the doctor's office. 12.4 million office visits, and you can extrapolate what the expense of that would be. And this year, 31,200 deaths
Just going to ask you about
associated with influenza. It's really a lot more significant than we think. And with the recurrence of the strain now, it is still really important to be vigilant. Eat well, sleep well, take care of yourself. Make sure that your immune system is as strong as it can, and get your flu shot. It is still not too late.
And I don't want to run out of time because I want to ask you a question. So if this Tamiflu, or somebody has the flu and they come to you, and we only have 3 minutes, so you have to talk fast.
No problem. So, the title of the talk today, What's Flu With You?
Yeah.
I'm going to tell you what's flu with you. When you come down with influenza, the most common medication that we have been using is Tamiflu. It's a pill you take twice a day, and it works best if you can get on it within the first 1 to 2 days. It is not curative. There is no cure for the flu. But what Tamiflu has been shown to do is decrease the duration of the disease. So instead of feeling like caca for 7 to 10 days, you might feel lousy for about 4 days. That's really, really important. And again, with the number of office visits, time off from work, the financial implications of jumping on it early is important. And now the newest thing is this medication called baloxavir, which is called Xofluza, is the newest medication. It is one pill. That's it. You take one pill within 24 to 48 hours, and it has been shown to really decrease the extent and severity of the disease.
So, Dr. WINOKUR, unfortunately, we've just run out of time, but I have to tell you, this was the most brilliant discussion, and we will play your show over again at another time, because I don't want anyone not to do what you've been telling them. And I thank you so much. I want to tell everybody again that Dr. Edward I. WINOKUR, WINOKUR, he is affiliated with Broward Health North, one of my favorite hospitals, and his not personal, but his practice. He has a personal practice in Lighthouse Point, and you can reach him by calling 954-933-9600. And I have to thank you so much for being here.
Anita, it was my pleasure.